So you work out, you've never had a baby, there are no real excuses for your pelvic floor muscles to get weak. So then the question is, how do they get weak? That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Pelvic Floor Therapy in Irvine, Orange County. You're really not fitting that stereotypical category of people with weak pelvic floor because, for example, you're not a female, you've never given birth or gotten pregnant, you're not overweight, you're not a smoker. Those are like the typical, stereotypical population. However, your lifestyle of sedentary life is a huge contributor to a weak pelvic floor dysfunction. Your postural presentation is huge. For instance, if you have an anterior pelvis like that, or you stand like this, now I'm over exaggeration, so somewhere between this and that, there are different shades of gray that you may belong to that actually negatively contribute to your pelvic presentation. Your hips, right here, how your legs are supported, how you stand on the ground, they're all contributing to your presentation of your pelvic floor and pelvic floor dysfunction. You may think, hey, I'm pretty active, I run every day, or I work out every day. Well, it all depends on what you're doing the rest of the time. So if you're sitting for 8 hours a day doing your work, and then you go for a run, don't think you're out of the hole here because you've had 8 hours of weakening an area, and then you go for a run where it's not necessarily being supporting the pelvic floor musculature or presentation. So to understand what your pelvic floor dysfunction or function status is, there are certain things we do at the office to assess that. I'm probably going to do a video gradually, like multiple series of things that we do to assess the integrity of pelvic floor. If you have not subscribed to the channel, this is your opportunity to subscribe so you get notified of any future videos that I have done. If you have any questions, make sure you use one of the methods of contact in the description box to contact me. Thanks for watching. Take care.